So, hello everyone, and welcome to this information session on the Master of Arts in Counseling and Spirituality, which is one of our most in-demand and popular program, a graduate program here at St. Paul University. First, before starting, I just want to say a big thank you to everyone who came in today to participate in person and also online. At the recruitment department, we talked to a lot of people, so it's nice to see the beautiful faces to put on those names. So thank you for all who came on our beautiful campus to participate in person. My name is Chanel Landry, and I am one of the recruitment officer here at St. Paul University. We've probably spoke at some point. So I work in the recruitment department, and today I am accompanied by my whole team. So I am with my colleague Chris Adams Yao, who is also a recruitment officer and who will also moderate today's session. And I am accompanied by my colleague Gabrielle Lefebvre. She works in the admission office, so she will explain and tackle everything there is to know about the admission criteria, documentation, deadlines, and so on. And we also have a professor from the School of Counseling and Spirituality who will come a bit later on in the presentation. Her name is Cynthia Bilodeau, and she works in the clinical practicum from the School of Counseling. So it's going to be a good reference to ask questions, specific questions that sometimes maybe at recruitment we can answer, some aspects of the characteristic of the program, the clinical practicums, and so on. So now we're going to tackle the presentation on the Master of Arts. So I'll start with a small program description about this master. So essentially, the objective of the Master in Counseling and Spirituality is to train specialists who can guide and counsel individuals, families, and couple regarding their values, their spirituality, and their individual or couple dynamics. Also, the program prepares graduates for a career in research. So in the program, normally students had the first trimester and then they had to select a certain concentration when they are admitted in the program. But this year, directly in the admission process, candidates must select a certain concentration for their studies. So the program offers two different concentration. We offer the individual counseling and also the couple and family counseling. So please note that the couple and family counseling allows someone that will practice to see couple, family, but also individuals, whereas the concentration in individual counseling, you will only see individual. And the other concentration, which is the couple and family, it has an additional accreditation that we'll go through a bit later in the presentation. But essentially, you will have to select one of those two concentration when you will apply to the program. So a bit about the program layout. So essentially, the program is offered full-time, and the full-time option is completed over 5 consecutive trimesters. The program is also offered part-time, but is recommended to complete full-time. And please note that in graduate studies, it's always consecutive trimesters, whereas you're part-time or full-time. So you can decide, for example, that this specific trimester, I'll be part-time. You're in the specific studies, either full-time or part-time until the end of the completion of the program. A small note that I want to say is the part-time option is part-time, but at some point in the program, you'll have to expect to be full-time because of the practicums, and the program will be 4 years instead of 2 years. So in the program, there is some compulsory courses to complete. So in the individual stream, students will have 21 course units to complete, and the couple and family stream will have 24 course units to complete in the program. So at St. Paul University, one course equals 3 units, if ever you were wondering. I know some of you probably have different system of notation, but one course is 3 units. And both streams will include clinical training. So those are the clinical practicums that counts for 15 units. And for the elective course, as you can see, the couple and family stream doesn't have elective courses to complete because they have an additional course in the compulsory courses to complete, whereas the individual stream, you will have at least one course of 3 units to complete. So we do have an optional thesis that's with the program. So it is an optional thesis. The thesis is also good for those who would want to, after the master's program, pursue to a doctoral or a PhD program. So please note that this thesis is optional and never guaranteed. How it works essentially, if it does interest you, students must first be admitted into the master's program and have at least completed 9 units of courses. So that's 3 courses. And then they have to consult with the school director to discuss the possibility of changing to that option. So now we're in the admission criteria. So I will leave the floor to my colleague Gabrielle Lefebvre. So there you are, Gabrielle. Thank you.
Before I get started, does everybody have a copy of the admissions workbook? Perfect. In case you don't, they are available at the table in the back. So yeah, my name is Gabrielle. I'm an admissions officer. I've been in the admissions team for a little over 2 years now, but I was also a recruitment officer for quite a few years before that, recruiting students in the Masters of Counseling and Spirituality as well as other programs. So I can answer quite a few questions about our admission requirements. So first and foremost, to be admissible for this program, you need to have obtained or be in the process of obtaining your undergraduate degree. So we are looking for an honors BA, which is a 4-year undergraduate degree, or its equivalent. By equivalent, we can also accept a 3-year degree if you've also completed the equivalent of an additional 30 university units. That could be in the form of a certificate program. It could be 30 additional units as a non-degree student, or it can also be in the form of a 2 or 3-year college level program, so either a CEGEP program or a college degree. Within your undergraduate degree, we're looking for at least 48 units, which is 16 courses in the human and social sciences in general. So we usually recommend studies in psychology, sociology, social work, health sciences, theology, or other similar disciplines, again, within the human sciences. But within those 48 course units, we're looking for some specific prerequisites as well. So you need to have at least 18 units, which is 6 courses, specifically in psychology. For this prerequisite, we can accept courses that are offered by any recognized university by a department or faculty of psychology. So here at St. Paul University, all of our psychology courses have IPA course codes. So they're offered by the Human Relations and Spirituality program, which is the undergraduate program of the School of Counseling. At most universities, you're looking at course codes that are somewhere along the lines of PSY, PSYC, Psych, things like that. So a department of psychology at any recognized university. Same goes for the next criteria, 6 units or 2 courses in sociology, social work, or intervention. Again, those courses must be offered by a department of sociology or social work at a recognized university. Or it can also be 2 additional psychology courses if you don't have sociology or social work. The last prerequisite category is you need 12 units, which is 4 courses in theology, religious studies, or spirituality. So for this requirement, we do have a little bit more wiggle room. Ideally, we're looking for courses that are offered by a department of theology or religious studies. However, we can also accept other courses from other departments as long as the main focus of the course is religion or spirituality. So normally that would be included in the course title. So for example, we can accept courses such as philosophy of religion, ethics and religion, as long as there's a word related to that discipline, like theology, religion, faith, belief, things like that, spirituality, in the course title, it can usually be accepted. If it's not in the course title, but the course description makes it pretty evident that that's the main focus of the course, you can always submit a course description along with your application for that course to be considered in the evaluation. So unfortunately, we often get requests for pre-evaluations of these prerequisites. We do not offer any pre-evaluations before receiving a completed admission application. That being said, this is why we created the admission workbook, which you have here with you. There is a lot of information about which types of courses are accepted for each category. And on the last page, we also provide a self-assessment tool. So you can grab all of your transcripts and kind of fill out that tool and figure out which courses you may or may not be missing. The next requirement is to have an admission average of at least 70%. So the way that we calculate an admission average at the master's level is that we take the last 50 units that you completed at the university level. Once again, at St. Paul University, one course is worth 3 units. So depending on your university, it may be a different number of units. But we're looking, for the last equivalent of 2 years of full-time studies, usually at the undergraduate level. But if you've completed graduate courses, that can also be taken into consideration. And then last but not least, for the required documents with your application, we ask for the transcript from all of your previous post-secondary education. At this stage of the application, we can accept non-official transcripts. However, if you do receive an offer of admission, you will then be required to submit an official copy. We're also asking for 2 letters of recommendation. We strongly recommend that at least one of the 2 letters be from a university professor. The other one could be from someone in a professional setting like a supervisor, but it is recommended, if possible, to get 2 academic references if you're able to. We also have an autobiographical questionnaire that we ask you to fill out. For both the questionnaire and the letters of recommendation, we do have templates available on our website. If you go on the admission steps, and then go find the counseling program, we do have some links to those templates that you can use. And last but not least, we're also asking for a resume just to have an overview of your academic and professional experience. The deadline each year for this program is on February 1st. Because it is our most competitive program, the deadline is a little earlier in the year so that we do have time to assess. So if you don't meet the admission criteria, maybe you're missing some prerequisites, there's a few options available to you. The first one is to enroll as a non-degree student. So this is a student who isn't enrolled in a specific program, but can take a few courses here and there just to fulfill these requirements. And then we also have 2 undergraduate programs that are offered by the School of Counseling. We have our BA as well as our certificate in Human Relations and Spirituality. The BA is your typical 4-year degree. If you've already completed a BA or a bachelor's degree in general before, you can get some equivalencies towards this program and complete it in a shorter amount of time. But this program is the only program that's guaranteed to have all of the prerequisites within the courses. And then the certificate program is a 10-course program that's offered on a part-time basis. So depending on how many courses you're missing or what your timelines your goals are looking like, these 2 options could be great for you, again, depending on what you're looking at. So the prerequisites, there is a deadline. The official deadline to complete these prerequisites is April 30th. That being said, we do occasionally offer some exceptions for students to complete some of these prerequisites over the summer before the start of the program. However, this exception is never guaranteed. And it can vary from 1 year to another. So depending on the program director that year, it can change from 1 year to another, which is why we strongly recommend that you aim to complete the prerequisites ideally by April 30th. In addition, those who have the prerequisites completed by April 30th will have a more competitive application compared to students who are missing prerequisites at that time. So just a quick overview of our tuition fee. I won't go over each number on here. I'll kind of let you have a look. We also have a lot more details on these fees on our website. But it is important to note that there is some ancillary fees, sorry, I always have a hard time with that word, specific to the master's program in counseling. And the reason for that is because there are some mandatory practicums in which you will be supervised by a registered psychotherapist. So this is mostly to cover the fees of that. There's also some incidental fees, which can vary from one student to another, depending on your student status and what you need. So the details of what that includes is also available on our website. Also, just to mention, these are the fees for this current academic school year. So if you're looking to apply for fall 2025. The fees are subject to change slightly. Now for financial aid and scholarships. So at the admissions level, we do offer admission scholarships. The scholarship is available to students who apply for a full-time study, as well as students who have a minimum average of 85%. Again, the admission average for the scholarship is calculated with the last 60 units that you've completed. So the total value of the scholarship is of $6,000, and it's divided within the first 3 terms of the program, so $2,000 per term. In addition to the admission scholarships, we also have a handful of internal scholarships. On our website, we also have some information on a few external scholarships. And also our programs are eligible for government financial aid. So if you live here in Ontario, you can have access to OSAP funding or whatever the financial aid program is in your province. Our programs are eligible for that. So just a quick reminder that the deadline to apply will be on February 1st. This means that you need to have submitted your application, paid for your application, and submitted all of the required documents by this date. As I mentioned earlier, we don't offer pre-evaluation. However, there is the possibility of getting an assessment before the winter term. So we usually open our admission portal around, I'd say, mid to end of October. The specific date does vary from one year to another. But if you apply right when we open our admission portal before the winter break, we can have a look at your application. As long as it's complete with all of the required documents, we'll have a look before the winter break and let you know exactly which courses are missing so that you still have time to enroll in those courses for the winter term. So that's kind of the only way of getting like a pre-assessment, even though you do have to apply to get that assessment. Candidates who are selected by the admissions office and the faculty will be invited for an interview. These interviews are usually around the end of March, and then by the end of April, we start sending out decisions. So this kind of wraps up the admission requirements. I will stay here until the end of the information session, so if you do have questions, we'll get back to that at the very end. But for now, I'll pass this along to Professor Cynthia Ledo, who's a professor in the program, and we'll have a lot of insight about the program and the specifics of this program and the practice.
So I'm Cynthia. It's a pleasure to meet you. I'm glad that you're interested in this fantastic program. I do want to highlight that it's one of the, well, I think it is the only program in the region that has clinical training with in-house. So when you attend this program, you're not necessarily obligated to go out and do an externship, although that can be an option for you if you choose to. But we kind of get you started right away, seeing clients in-house at our training clinic. And we hold your hand while you do it the first time and the second time and the third time until you're ready to start kind of flying on your own. So there's a luxury to having a clinic in-house, and we take full advantage of it in this program. So the program, integral approach combining aspects of counseling and spirituality. Spirituality broadly defined, integrated within psychotherapy. When we talk about, or when we consider, are we doing, spiritual counseling? It's a little bit different. What we're doing is we're learning about what spirituality might mean, how it might be defined for people, how it might play out in people's lives, and the place that it might occupy in their life. And so it's an important aspect for us to consider when we're thinking about doing psychotherapy with a person. So traditionally, when I was trained, we talked about cognitions, behaviors, and emotions. And we work with thoughts, we work with emotions, and we work with behaviors, and we develop a treatment plan that we think is most appropriate. And what brings it all together really is someone's worldview. What resources them, or where do they experience support that might be outside of interpersonal relationships? Can it be transcendent, or an experience, simply walking out in the woods that is calming and soothing. So spirituality can be a really important resource. It can occupy a core place in someone's life, and it needs to be considered in the treatment plan. It can also be a source of distress. Somebody can struggle spiritually. in some of the research that I did on women in with breast cancer diagnosis, so going through the process of diagnosis to treatment, a lot of the question they asked was, why me? You know, and is God punishing me? And so that may play in, or it may not play in. But when it does, I think as therapists, as psychotherapists, as clinicians, if we're trained to identify that suffering, we can attend to it as well as the thoughts, the emotions, and the behaviors. Right? And so that's why we talk about combining aspects of counseling and spirituality. It's an integrated approach. And even now you see it much more generalized in regular psych training programs, that biopsychosocial model. Oftentimes now you'll find it online and in different programs, biopsychosocial spiritual model. And so it is of day, and it's important aspect to consider. So that's oftentimes the question I get, you know, is it counseling and spirituality? It's integrated. It's kind of spiritually integrated psychotherapy, where if it's relevant for the person, we're trained to identify and address it. Considers the personal, professional, and spiritual development of students. This is a program where you will learn to do psychotherapy, but it's ultimately a transformative program, because in order to learn to be a psychotherapist, our college identifies one of the primary competencies, which is safe and effective use of self. And really the Coles notes to that is, am I reflecting on how who I am as a person, what I'm bringing into the room translates into how I communicate with another, how I receive them, how I listen. And so we ask you to reflect on that in that program, because once we start recognizing what we're bringing into the room, we're in a much better position to engage in an intentional relationship with another person, right? So we're not just reacting without thinking about what we're doing, we're acting with intention therapeutically. And that's the core competency of psychotherapy. And so we really take that to heart here in this program. So a lot of the activities that we do is we really think about, you know, how come that angers me when I hear that? You know, why am I so annoyed? Or, you know, I really want so much for this client that I'm going to do everything I can. There's different reactions that we have to people, and when we start thinking about that, we start thinking about how that reaction impacts our actions. And so we invite you to transform with us, because ultimately every encounter with another person, whether in a therapeutic setting or not, but especially in a therapeutic setting, is unique and can be transformative for us as well. So we need to do that with intent and responsibly. Sounds good. Theoretical courses and clinical training. Yes, we have the theoretical courses. They're super important. I know you're eager to learn all about the theories of counseling and spirituality and research methods and all of that that comes to graduate school. Because I'm laughing, but it's actually one of my favorite classes. So give it a go, give it a go. The clinical training aspect is something that we integrate from the very beginning. So you will learn as you're doing. And so as the first semester you have actually in this program, you will be in the practicum course. And so that means we will be doing therapy. In the course, we'll be learning it right away, but we'll expose you to clients when you feel that you're ready. And oftentimes that comes around October, November. You get one client and you get a full 2 hours of supervision after to debrief. You get a full 2 hours of supervision to prepare for your first session. You've had the training. We record it. It feels uncomfortable at first, but afterwards we realize what a wealth of learning it is, because you learn to become a psychotherapist, to be a therapist really quickly in this program and right away, because it's the core of our practice, really. And so as you're learning these theoretical concepts, you also get to integrate them in your practice, which is, I think, a great way of learning. Master the skills and techniques to help people in need. This is an accredited psychotherapy program, so you will be eligible to be a member of the CRPO when you graduate. So you'll be a licensed clinician. And the hours that you do here in the practicum actually will count to your qualification. So it's no time lost. Gain a good understanding of interpersonal dynamics, absolutely. You know, the core of the program is really about building relationships that are therapeutic and developing interpersonal resources and supporting others. And that we learn to be kind to ourselves as well as we're going through that process. So interpersonal and intrapersonal as well, I would say. To graduate from the program, you will see 150 hours of supervised face-to-face client contact hours, 150. And that's a requirement of our program. The beauty of it is those 150 also count to your regulatory body. So when somebody gets licensed with the CRPO, for the first 450 hours of clients that they see, they're qualifying. So they have the status of qualifying psychotherapist. And so you're required to work under supervision. There's a recommended ratio of supervision to client hours that's there. But when you graduate from our program, you already have 150 hours of that done and many, many hours of supervision. So everybody in our program, when you are doing your practicum, you will always be supervised by a licensed psychotherapist. That's a requirement of your regulatory body. So we will always ensure that you have a qualified supervisor that meets the standards of the qualifications of supervision for your college in order to ensure that your 150 hours can count towards your professional status. And your professors are psychotherapists and psychologists. So you learn from licensed clinicians who are in active practice, right? So it's fun. And you learn how to do from people that are doing, and I think that's the richness in this program as well. Clinical training and supervision take place at the Counseling Center. Yes, we are lucky. We have this beautiful counseling and psychotherapy center on the second floor of the residence. It has 25 clinical rooms, 5 supervision rooms. There's full-time staff, and there is students seeing clients all day long and receiving this training. And like I said, we get to do it in-house. So it feels comfortable so that when you go out into the world, you're prepared. You're prepared. And so we do have state of the art. Every room has a camera. So it's not like, I don't know, when I was training, maybe I'm giving away my age, but we had to set up a tripod. And then our client would walk in, we would sit them and then run over and turn on the tripod and then run back and sit. And there's a level of awkwardness that comes with that, which was fine. It was fine. But the way that we're set up now, everything just automatic records at the time that it's registered to record when you have reserved the room. So it's seamless. It's seamless. Then you have access. You can view it. You can show parts to your supervisor. You can, and then they all get erased, of course. But the idea is the best way to learn is to watch yourself, right? And then to reflect. And research tells us that. And I think my clinical experience teaching for the past 15 years has been that it's uncomfortable the first time. And after that, it's just this golden tool that we have, and we're lucky to have access to it. So we have an in-house training center. So we teach you everything from what to say in the first phone call when you're calling your client to termination. How do we end sessions so that they're beneficial for clients and that we're preventing relapse and increasing prognosis. So all of that. Sounds good? Aside from our center, students can complete an externship now. You can. You don't have to, but you can. So if you have a particular interest, I want to work with, I don't know, a teen population. I want to work with a population addiction. I want to work, and you find a site that is willing to take you on and wants to teach you how to work clinically with a certain population. Go ahead, we'll support you in that as well. We do require you to see some clients here at the clinic so that we can continue to monitor and, you know, your practicum courses, because you'll be taking practicum throughout the program. But if you choose to do part of those hours externally, like in a clinic or at a community center or whatever your choice is, you can also do that. Counseling and Psychotherapy Center is located a hop, skip, and a jump from here, just right there. It's this building here, right? I get confused walking around, but it's right here, it's on campus. You seek a community sample. So you're not seeing students from the university, they have a counseling service for students. You are seeing a community, people that are from the community who are struggling with a variety of different struggles. So you will be exposed to different problems and from real clients, from our real community. We are one of the largest centers in the National Capital Region. I think last time we checked, there's about 300 to 400 appointments being seen per week. So it services on a sliding scale, which also allows us to follow the mission of the university, right, which is to support the community. And so we're able to do that in these services that we offer. We have the luxury of being funded, right, to a certain degree. And so we can offer low-cost services to populations that would not always have access to service. Diverse clientele, like I said, it's a community sample, so the issues will vary. And so that will expose you to more different experiences. Your supervision will be dyadic. So you will have 1 hour with your supervisor to talk about your clients. And you will have a partner present. And then you will be present when they have their supervision. Not all the time. I think it's 3 weeks out of the month, and then you have an individual supervision. But what that does is that allows you to see more a larger case, a broader caseload of that. And so if, you know, you have clients that are struggling with anxiety, depression, and your partner then reviews a case of grief, now you know what that can look like too, and what the recommendations are for working with clients that are grieving. Fees based on client financial needs. I talked about that in terms of the sliding scale. So we can provide services to the community, really, not just the ones that can afford it. You will be certified. Now there's, you will be eligible to be a registered member of the CRPO, so you will be licensed, but you're also eligible to be a member of the Canadian Counseling and Psychotherapy Association. So an association is for you. And so associations support therapists that provide you with resources, information within the realm of the work that you do. Your regulatory body is to protect the public, but you need to be licensed by them to practice. And our program, our students are eligible to become members of both the association and the regulatory body. We also have different concentrations. So we have individuals. So you can choose to focus on working with individuals, or you can also choose the couples and family stream. So in the couples and family stream, you still work with individuals sometimes, but you also learn how to work with couples and with families. And it's mainly a systemic approach. So in the couples program, you'll learn I guess, a broader and a variety of therapeutic approaches and interventions, and working with couples and families, mainly from a systemic approach, but that allows you to work with couples and families from that approach as well. Okay. This program is not directly accredited by other colleges outside of Quebec, outside of Ontario. So we get this question every year, you know, can I be licensed to practice psychotherapy in Quebec? Not necessarily. They have a different process for being licensed. There are some provinces that are not regulated that you can practice it. But I think about 6 of our provinces currently are regulated, Quebec being one. Okay, but the process is different for being licensed, and they go through the College of Psychology. So what do psychotherapists do when they graduate? Where we typically see them really are in these places. They go to different counseling centers. They go into private practices, they go to community centers to service the community, and many of them work in the government as well. There are counseling positions in the government, or they take on different positions. But most, from my experience, I don't have the stats on this. This is just me keeping in touch with my students, but most of them do practice, and they practice here in the community in Ottawa. So there is a need. It's sometimes difficult to access services. Yeah, so that's where they are.
Thank you everyone for coming today to this info session, and a big thank you to Cynthia and my colleague Gabrielle and also Chris Adams-Yao that was moderating today's session. It was a very good presentation. We got a lot of information. So thank you so much again.